Hi, everybody. Welcome to another edition of Race Today. I'm Lisa Tivala, one of the co-producers, and today we are going to be discussing Black mothers with our distinguished guest, Dr. Karima Forbes, who's a psychologist. I'd like for her to introduce herself to share with us about her background, and then we'll start our conversation. Take it away.
Great. Thank you so much, Lisa. Happy to be here to talk about Black mothers, the Black maternal experience. I am a Black mother myself, obviously, and I guess some of the other things, I am a licensed psychologist. I'm currently in private practice. I also am a organizational consultant. In the context of my private practice, I have encountered many women who are navigating motherhood, Black women navigating infertility. I think that historically, people have really sought out my services because I am a Black psychologist and felt like in some ways they would get different care or better care because I might see them in a way that they don't feel seen by some other providers. And so it's really given me the opportunity to work with Black women who are navigating, I think, a lot of the complexities of life, work life, parenting, trying to conceive. And so I feel like I've done a lot of work in that area. And I think obviously just general mental health related contexts and issues. I've worked in hospital systems, education systems, different spaces that have really given me different insights regarding the experience of Black women. So
And
I can
how old are your children?
so I have three 2-year olds. I have 2-year-old twins who just turned 2 in March, and then I have a singleton who will turn 3 later this month. So they're about 10 months apart, all girls.
Oh my, that must be a lot of fun.
That's one way to put it, right?
So, clearly you became a psychologist before you became a mother.
Yes.
Were you prepared for what you were going to face? Did you take care of your siblings, or if you're an only child, or nieces, nephews, or cousins before you had your own kids, or did you learn yourself just from experience?
Yeah. Yeah, you're right. I've been a psychologist for about, I guess, almost 10 years, and I did practice with a master's level degree for some years before that. But prior to becoming a mom, I think I'd had, some experience related to my niece and nephew, who, of course, I was happy to be a part of their life. And I think I didn't, even watching my mom, who I think is like kind of the epitome of what we think of when we think of a Black mother, working multiple jobs, doing all the things, which I think sometimes is we see as like this superhero like, but I think it's definitely can be a burden that Black women carry. But I'd seen all these things, and still, as I was navigating becoming a mother, I felt like I had no clue what to do or what I was doing. And I think when you're up against kind of knowing some of the history and the context of Black maternal fetal health, it feels scary. And so I didn't feel prepared. I'm not sure that you can ever feel fully prepared, but I think I felt very scared navigating the process.
So how are you helping now your Black mother patients, since now you have these life experiences?
Yeah, so when I first started practice, I worked in a hospital context, and Black women would request me as their provider or request a Black provider. And I think I would just initially was very just supportive. I didn't necessarily like couldn't understand what they were navigating in terms of their fertility or, becoming mothers for the first time. I didn't understand as a person who's lived the experience, though I could really relate and connect to the fears that they spoke about, especially in the context of what we were seeing more on a system level. So I think initially it felt very supportive. I think over time, in terms of because of my own self education and also starting to navigate the space as also a Black mother, I feel like I've started to be more of an advocate in ways and really try to help the women that I'm working with find voice when I think that we are navigating and living in systems that don't always want to, or not want to, that they don't let our voices be heard. And so I feel like I've become more of an advocate over time as I've learned more.
And I'm kind of curious though, the systemic racism that we see in different levels of our society still in 2024. What do you, how do you make recommendations or suggestions to your Black mothers who are trying to seek, good health care? I mean, think about it. What was astonishing to me was when that Olympic athlete, Tori Bowie,
Mhm.
um, she died, as a, I think when she was trying to give birth or before, something happened. And I
Mhm.
just thought, an athlete, first of all, you think is very healthy. So how did she not gain access to what we would think she would
Yeah.
to the best health care to prevent something like this tragic happening to her death?
Yeah. Yeah, I mean, I think the systemic issues are scary, right? I think that we would think that someone, I think a lot of times we think about access as the biggest issue, right? That we're like, all right, people don't have access to good healthcare. Definitely a part of it. But the case with Tori Bowie is that she had access to healthcare. She was well known, world known. She was successful, an athlete, and even someone with access and money, right? We've also heard about Serena Williams and other people in medical professions who are other doctors who also are dealing with these complications as Black women. And so what we realize is that it's really not just about access. Even in the context of access, other systemic related issues perpetuate. So some of the things that people talk about that come up in these spaces are um, not feeling heard, right? You're asking for help or reporting pains or reporting concerns about things, and it's dismissed by providers or professionals in those contexts. People also talk about, they may be reporting particular levels of pain or symptoms that are again not really heard or taken seriously. And so, regardless of your money or your fame or how known you are, people still deal with a lot of the weight or burden of being Black in that way, where you're not seen, you're not valued, different things like that. So those are things that I think that it doesn't necessarily matter who you are, you still have to deal um, with those types of issues, which is unfortunate, obviously, and scary.
I wonder if you could kind of elaborate a little bit more, like, for example, like, you assume like when you go to a doctor, they know that you're going to be in pain. Why are they not taking you seriously?
Yeah.
What are they assuming?
Yeah, I mean, I can't speak to every provider. However, I think what some of the literature is telling us is there's just like this assumption that pain should look a particular way or pain, for example, some of the literature talks about uh, that Black individuals who are reporting pain are oftentimes perceived as medication seeking. And so I think some of these stereotypes or biases that we carry can really impact the way that we engage those spaces. So I don't always think it's a conscious process. I don't think that people are like, hey, this person's Black, I'm going to treat them terribly. However, I think and sometimes that does happen, don't get me wrong. I think that
Mhm.
obviously there's some um, overt racism. And I think that when we think about implicit biases, these are when the stereotypes or the things that we don't even always realize have had an impact start to play out in these spaces. So, for example, you hear examples of bias when people, are you might see a Black person in a hoodie. And you make a particular perception, or maybe I'll cross the street because of this person, but in your mind, it's not like always at the forefront exactly why you're doing the thing. However, history, media images, all of these things tell you that this person is dangerous. And so it's imprinted in some way. And so I think that that's what plays out in healthcare is that there are these imprints of about people and how they look, and they play out automatically in these moments. And so we perceive people maybe more violent or more problematic because of how they look. And so that then impacts the way that we engage everything, what they tell us, what their requests are, what they're asking for. And so I think it's like complicated. I think that a lot of the biases or implicit biases really play out in these moments.
So, what do you recommend to your Black mothers, especially when they have a provider who isn't Black?
Yeah.
What do you recommend? I assume it's easier for them to communicate with the Black physician, but I'm not sure. I wonder if you could talk about that too.
Yeah. I mean, I think a lot of people seek out Black medical providers or providers who look like them because there's this assumption that I'm going to get better care or I'm going to be heard. And we're seeing a couple things. Yes, I think that there are a lot of Black providers who are doing amazing work and giving voice to patients who look like them. And there are also Black providers who perpetuate the system, who have also internalized some of this racism and treat patients who look like them in the same way that perhaps their counterparts would of other races. And so I think in some ways, yes, Black physicians do amazing work and are really, I think, the ones oftentimes that we see in the forefront addressing the disparities, addressing healthcare related issues in this way, and really carrying the burden. I think that what's really, that we don't want just the weight on Black physicians. I think really the weight should be on all healthcare providers to really um, uh, tend to these disparities. And I think that a lot of people talk about, when it comes to diversity related content, it really starts with awareness and acknowledging the history of these systemic disparities, right? That it didn't start yesterday, it didn't start today. Our history is fraught with examples of systemic disparities in all systems, right? Obviously, we're talking mostly about healthcare today, but education, criminal justice, I mean, housing, right? I think we can go on and on. And so I think it starts with knowing and understanding this history, how it continues to perpetuate, and what is the action? How do you engage or create spaces differently for Black patients to speak their truth, speak their experience, to feel heard, validated, acknowledged, and then treat accordingly? And so
So
it's
what do you suggest like our listeners do, like, that to promote better, not access, but better healthcare so that they are being heard, they're being taken seriously, they get the proper treatment to prevent, their condition worsening.
yeah. Yeah, this is hard. This is hard because I think, I've heard from people who have, done the best advocating for self possible, who continue to speak up when they're shut down, who are when they're silenced, who seek other providers when they're not getting what they need, and are still feeling like they ultimately couldn't get what they needed. And so I think on one part, you want to tell people, you want to like empower people and help them find voice and help them advocate for all the things that they're needing. And that's like, it's a very one-sided thing, right? Because you're pushing up against a system that's not hearing you. And so we can't control the other side. I can help my clients advocate for self, and I can't guarantee that they're going to get the outcome that they need. And so I think in some ways, I try to empower and help. I think a lot of times what we end up doing is really helping people learn how to cope with navigating systems that are hard to navigate, that don't hear you. And the reason for that is a lot of the stress. When we're thinking about Black people, also, right, there is a stress response that they experience when in the face of these disparities, right? So a lot of the literature talks about not just the mental health related effects of racism and discrimination, but there are physiological effects to carrying those experiences, right? When we think about hypertension, when we think about other medical issues that people experience from weathering racism and discrimination and this like constant experience that's not like a one-time thing for people. And so I think coping becomes really important because you also have to um, help people navigate situations that feel beyond their control. And so, what can I take control of and manage in a way that gives me some autonomy or empowerment when navigating some of these disparities?
So let's
Also
say, for an example, you have a doctor who is not really listening to your patient, right?
Mhm,
What do
mhm.
you recommend? They try to get the doctor to communicate differently with the doctor or find a new doctor. What do you recommend?
You could try to communicate differently with the doctor, and it may not make a difference. So, if a person feels like they have voice, then I tell people, there's patient advocates to speak to, or you can recommend another doctor. And oftentimes, people don't feel like it's within their rights to request. I'm sorry, not recommend, request to request another doctor. Even requesting a Black provider, it's within people's right, and people oftentimes don't feel like they should make that request, that they should just be happy with what they get, especially if we're thinking about people who may not have health care. And so they may feel like, whoever I'm assigned, like that's really what it is. And so I think sometimes people feel like, and I think that's part of the internalization of the system is like it takes away voice. And so I tell people, if obviously I want to empower and encourage them to speak up for self, but I think people can always make that um, request, and it's within their right to, especially if you don't feel like you're being treated in a way that's fair or just.
So what do you recommend for self-care and even, for yourself? What do you find helpful? And then what do you recommend for Black mothers?
Yeah. I think self-care is like, I think in becoming a mother, it's become even more of a mystery in some ways. I'll acknowledge that as a psychologist, I'm oftentimes telling people self-care, self-care, build your toolbox, all your coping. And sometimes self-care feels like a luxury to access when you are trying to navigate the world, not just for self, but for your families, for your kids, wanting to make sure that they have the best experiences, opportunities. And so I think sometimes it can feel like there's no time. There's no time to like take care of myself. And obviously, my psychologist in me is like, hey, if you do not take care of yourself, you will not be what your children or your family needs, right? I run the risk of burnout, fatigue, all the things that take away from my ability to be present for family. So I try to communicate that to clients that I'm working with. I try to highlight that yes, we perceive self-care as a luxury, especially when there's stereotypes about Black women being, they do everything. They can have all these jobs and they can carry all the weight and burden and do so much. And I think sometimes we feel like um, we can't slow down or take a break. And so I think I oftentimes have to provide psychoeducation about why you need to do this thing, and then start thinking creatively about what it can look like, depending on a person's means, right? I think that we can all say, let's go get a massage or take a day off of work. And depending on people's lived experiences or context, that may not be a real option for them. And so, really thinking creatively about what self care looks like, and also recognizing that this looks different for different people. For one person, a massage may be like what they need. For other people, they may need to just take a walk or write in their journal or take a hot bath with aromatherapy. And so I think part of it's helping people build their toolbox and identify things that actually work for them. Um, yeah, I would say that.
So I was wondering also, like, is it something that I know it depends on the individual, but
Mhm,
maybe like 10 minutes every day, like either in the morning or evening or afternoon, like either like some meditation or a little bit of breathing exercises. If you have more time, you can do some yoga or
mhm.
once a week, try to schedule a massage if you can do that. I'm wondering, like, what do you do when you are with your clients? Do you make suggestions, or that they need this type of thing more because of what they're going through?
Yeah. Yeah, I definitely make suggestions. I think the examples you're giving are great suggestions to start with and really encourage people to test it out. And I tell my clients all the time, "Hey, we're trying this thing. If it doesn't work, that's fine. Let me know and like we'll move on to the next thing." So I think sometimes it's really like trying things out, seeing what works. Another part of this is that depending on the intensity of the emotion you're experiencing, certain things are going to work and certain things won't. So if I'm at like a 10 anger, listening to music's not gonna cut it. But if I'm at like a 2 anger, it might. And so really I think part of what you're talking about, these meditation or mindfulness exercises, what they really help with too is like helping you tune into self, right? What am I feeling in my body? Where am I carrying my tension? And when we're connected to our bodies in that way, we can engage differently in the coping. So I know that when I'm feeling a lot of physical tension, I need to do certain things. And so I think teaching coping is about teaching all of these different things, how to connect with self, how to know what you're feeling and experiencing, and then identifying what you can do in those moments. There's some people I've worked with that they need to take a minute and go to the bathroom at work, and they do a breathing exercise in the bathroom. And so really like how do we think creatively or outside of the box about how we're engaging these strategies? I think some people think, oh, I have to wait till I can get away or take a day off or wait till the weekend. No, you really need to like be engaging these things as you're going. so that you don't get to a 10 or to burnout. That's the hope. Because once you're at burnout, it's harder to engage any of these skills.
Mm, okay. Um, Now let's see. We have a few more questions from our producers. Well, a couple of them. Let's see. We did the self-care, but what are your thoughts on Black midwifery and doula care as it relates to Black mother care?
Yeah, so that's an interesting question. And it's something that honestly I probably didn't know much about until a few years ago, and I still didn't engage those resources. Now, on this end, a few years later, I'm like, I wish I would have. Because when we read about midwifery or doulas and the role that they play for birthing, I mean, it can really have a profound effect on the experience of Black women. And historically, it has. I think what has happened over the years is that there's been a medicalization of childbirth, right? Once upon a time, midwives and doulas, that role, even without the name, was much more common. When we think about the slave communities and the birthing that would happen there, where there's this emotional and physical support provided in a way that I think we've kind of lost in the medicalization of some of this, right? And so I think that what we're seeing now, or what people are talking about when we're addressing Black maternal health and the disparities, is that doulas and midwives are individuals and roles that can really help with navigating some of these disparities, where we're thinking about how can Black women have more support and feel more heard and empowered in these spaces. So, some people will talk about their experience with doulas and feeling like, I'm in the middle of childbirth and like can't advocate for myself. And they've had a doula who's able to kind of engage in that way for them. I've also had clients who have specifically looked for birthing centers with midwives to deliver their children because they feel like their again will be heard differently, or that their safety will be considered in a different way. And so I think that a lot of people who have access and ability to engage with midwives or doulas are doing more of that in an effort to navigate some of what we're hearing about Black maternal health. And one of the issues is access. There's communities who don't have access to doulas or midwives or can't pay for them. And so I think that access and resource becomes a big issue, even though this could actually be an area that's really helpful. And the amount of midwives, I think historically, again, there were many more than we're seeing now. And so I think that the numbers of midwives are decreasing, and I think it's probably because of the medicalization and the difficulty with accessing some of these services and supports. Um,
Yeah. What resources do you encourage Black women, especially Black mothers?
Yeah, I think, there's some really great websites, books, things out there. I think what I've seen be pretty beneficial for a lot of Black women is also, which is also a coping that I didn't mention, is really finding community. I think that navigating all this can really be isolating. I mean, obviously, we know there's other Black women, and we know that other people are navigating Black maternal health or infertility, but it can be really isolating because I think there's stigma to talking about the difficulties that you're navigating. And so I think that people have really found benefits in or resource in connecting with other people, hearing about how other people have navigated the systems, hearing about other providers that people have had good experiences with, right? I think some of those passing along of resources within a community of experience can be really helpful for people also. But there's something so beautiful about feeling about the ability to connect with other people who are also navigating some of these difficulties that can be really isolating.
Yeah, especially with the technology we've noticed, with Zoom, especially during the pandemic. I
Yeah,
assume more people like to be in person now since they can.
yeah,
And the other thing is that what was I going to bring up? Oh yes, patient advocacy. Given that, what you had explained before about the type of systemic racism that is internalized within our within people not just, physicians, but all walks of life, right?
Yeah, yeah.
Um, have you come across any type of patient advocacy groups or something that might promote maybe like awareness to physicians, whether they're black or white, how they should be uh, being a lot more compassionate in their patient care, and
Mhm.
not just internalizing this type of assumptions that they have that they're not even aware of, even if they're black. Is there anything out there?
Yeah, I mean, there's no shortage of resources. I mean, there are so many books and there are so many organizations that are really trying to speak to healthcare related disparities, Black maternal fetal health. I think the issue is that the onus, unless the system that you work in is really pushing for change, the onus falls on individual providers to educate themselves and to kind of embrace this knowledge in a way that they can start to really engage the action in a way that's going to be effective and helping their clients. So, I just read this book a couple weeks ago by Uche Blackstock. It's called Legacy. She's a New York City based consultant essentially now. She worked within the medical system. She worked for NYU and really tells her story in a amazing way. But she speaks to the systemic related issues, and now she's trying to address them externally. She does a lot of health disparities related work, trainings. There are so many people and organizations like her who are trying to do this work. And it's really a matter of like who lets them in to provide knowledge and education to the space. And, I think what we're up against now too is a lot of pushback against diversity, equity, and inclusion. And so what's happening is I think that people are hearing, hey, this thing is not important. And so again, the onus now is falling even more on you know, the organizations or the individual providers who think this is important when really it should be a systemic level change. But yeah, so long story short, there's so many resources. So many people are trying to do this work, and make a change and a difference for um, Black people, Black women in particularly in this context.
Well, I really thank you so much for sharing your own insight from your experience as a psychologist. I wonder if you had anything else you wanted to add before we close.
Anything else I want to add? I mean, I'm happy to be here. I think that I obviously like I'm very passionate about the Black maternal experience, and I think just generally, I think issues related to diversity is very important to me as someone who like had a long history of internalized stuff where I couldn't find my voice or didn't feel like I should speak up or felt like I should default to people that I perceived to have more power than me and felt very silenced in lots of spaces. I think that this is like a big journey. It's a journey, it's a process, it's something that I'm constantly navigating as well. And so I recognize that like it starts with awareness and my hope is that people, maybe hear this or hear from other people and then it really encourages a journey of starting to learn in a way that really leads to action. Because I think it's going to take not one of us, but all of us to change this thing and to really create a space where people are treated in the way that they deserve to be treated. And that women shouldn't have to, you find out you're pregnant and you worry about your life and your child's life in a way that I think that other people who identify don't have to experience in the same way, that burden related to some of the statistics around Black maternal health. So, yeah, that's it. That's all I got to say.
Thank you so much. I learned so much, and I believe our listeners did too. Thank you so much for being a part of our show today. Have a wonderful week. Bye.
Thank you for having me. Thank you.